Yeah, my name is David Swoboda. I am the Director of Leukemia at Tampa General Hospital in Tampa, Florida. And I'm really excited to talk about, MDS. We've had a great year in myelodysplastic syndrome with two pivotal phase 3 studies being presented at ASCO. The first being the COMMAND study with luspatercept. And so this was a frontline study, extremely practice-changing for a lot of MDS clinicians and researchers, ultimately showing that in transfusion independence rate at 12 weeks was about twice in the luspatercept arm compared to the ESA arm. And prior to this, erythropoiesis stimulating agents had been the standard of care for a frontline therapy in lower risk MDS. So it really changed, what we do commonly in practice for these transfusion-dependent or symptomatic lower risk MDS patients. The second trial that was presented at ASCO was the IMerge trial with imetelstat. And basically that was ESA refractory patients where that was studied. And ultimately they found about a 40% transfusion independence rate at 8 weeks. Compared to placebo, it was about 15% in the placebo arm. This trial was in a higher risk, low risk cohort, so patients that were highly transfusion dependent compared to what we had seen in some of the ESA refractory second line studies. And so the field is extremely exciting about this data, that was presented and will actually be presented again at ASH later on. Outside of the two phase 3 clinical trials that are ongoing, there's a lot of different drugs, both in lower risk and higher risk MDS that are being explored. In lower risk MDS, we talked about frontline luspatercept approval, and we also talked about the imetelstat study. Recently, ivosidenib was approved in myelodysplastic syndrome, FDA approved, as well as there's a lot of other studies in low risk disease focused on inflammation and inflammatory pathways. Data being presented about canakinumab, which is an interleukin-1 antagonist. Also data being presented with other inflammasome type pathway targeted therapies. In higher risk disease, it's been more challenging. And so, everyone was really excited about magrolimab, which is a CD47 antibody. CD47 is primarily on leukemia cells, but basically allows macrophages to be activated and ultimately go in and phagocytose leukemia cells. And so this was combined with azacitidine, which is our standard of care therapy for higher risk disease. And ultimately we felt fairly confident that based on the response rates in the early studies, that we might see approval here. The reality, however, is that that study had to close due to futility, and so we're still looking for novel immune-based therapies in the higher risk MDS state because there's been several ongoing studies, but ultimately when they go to phase 3 and get randomized, they for whatever reason, whether it's disease heterogeneity or patient selection or underpowered, they don't end up being positive studies. Another thing that I think the MDS community is extremely excited about is moving a therapy that has been game-changing in AML, which is vidaza-venetoclax, into myelodysplastic syndrome. So in the Viale study was the phase 3 for vidaza-ven in elderly unfit patients, and with AML, and ultimately was a positive phase 3, and now that is what we standardly use for our elderly or unfit AML patients, get a lot more patients to transplant, improve a lot of quality of life with these patients. But now